And so, and there we go. We are now officially being recorded for all voting Anchor members. And we will kick this off from the state of Virginia with Precious Myers Brown from Health and Joy Services as the Chief Innovation Officer. So Precious, we'll turn it over to you.
Hello, everyone. Good day, and thank you for having me. My name is Precious Myers Brown. Some people call me Preciosa, but it's to each his own. I will answer to all. I'm currently serving as the Chief Innovation Officer at Health and Joy Services. I'm also the CEO and Dream Officer of Vista Supports, both members of ANCOR. I am so thrilled to possibly serve on the ANCOR board of directors and further contribute to an organization that's basically been a part of my almost entire professional life. And with 35 years of experience in the field, ranging from being a DSP to all the way to C-suite, I've seen all the different levels and I understand what it takes to do what we need to do in this field. I also understand the challenges that we face and understand that we need to be innovative, intentionally innovative, to be able to prepare a future that will embrace us and that will continue to support people with disabilities. I have, over the last 10 years, I would say maybe closer to 13 years, been focusing on enabling technology, innovative solutions to address gaps in the field, inequities, bring people on board to level up people in our community, to bridge the digital divide, because our future and our today are currently different. The people we support will be supported differently. The services that we fight for legislatively will be different. And we need to be intentional about how we prepare ourselves for that future, prepare ourselves for our now. While services are being advocated for and we have legislative need in there, the people we support still have needs. Providers still need solutions. And I believe being innovative and strategic is the method to which to do that. My current involvement, I've been actively involved in ANCOR for about 15 years. I am also on the ANCOR Foundation board, which is near and dear to my heart because I believe in leadership development. I believe that if we want to have the future that we're dreaming about, then we need to prepare our future leaders and align our strategic initiatives associated with that.
Have my water up for me, please.
Sorry.
Yeah.
I love.
Could everybody please mute?
I'm sorry, I thought that was a question. So my commitment to enabling technology, tech first, and innovative solutions is what guided me to develop the first smart home for people with IDD in the District of Columbia. Did it without support, did it without government approval, but we made it happen. And then it became a solution that then was used as the basis for creating the enabling technology waiver in the District of Columbia. So my commitment to helping build leaders, helping to lay the platform for strategic initiatives that will be a solution for us in our future, as well as aligning our strategic initiatives towards legislative advocacy. I have a big mouth, so I'm not afraid to advocate. I'm not afraid to step in front and say what we need to say. I've never shied away from that. And so I represent those whose voices have been silenced or tend to be quiet due to whatever challenges they face in society. I believe that I represent the diversity that's in our community and able to speak on behalf of those so that we get all of the services on the table or solutions on the table for that, so that people can, live their best life and live their best life working in this field, and government to feel good about what they are supporting for us. I look forward to bring my passion for innovation and community empowerment to the ANCOR Board of Directors if selected. And I thank you for my candidacy, and I'm excited about the possibility to do more.
Thank you so much, Precious. I am excited to introduce our next candidate, Patrick Maiden from Ohio. He is the president and CEO of I Am Boundless. Welcome, Patrick.
Thank you. So what I would bring to the board, I think, is different perspectives, different ideas, planting seeds to think a little bit differently. 7 years ago, I became the president and CEO of an organization that served adults with disabilities in one line of service in one county of Ohio. And we were about a $20 million organization. So jump ahead to today. Today, our organization is in almost every county in Ohio, and we'll hit $180 million this year in services. Now, we didn't do all of that to just become the biggest or grow the fastest. We did it because we had a plan that involved how do you break out of the Medicaid swamp of funding and create sustainability. And we did that really by focusing on an integrated care model for whole person care. All right, the whole concept that people with disabilities don't just reside in the IDD world, they also reside in the aging world, in the behavioral health world, substance use world. And if you look at our funding today, we're working so hard in the IDD world to pull every cent we can out of there. Maybe we need to think smarter and think about, are we doing a disservice to people with disabilities by just focusing on that, when we could be, if people with disabilities are residing in all those different areas, then we should look at braided funding. We should look at integrated care, all the things that my organization has done to create sustainability and better service model. So I believe that the rising tide floats all boats. And I can say that over this past 5 years, I might not have been around ANCOR as much as some other people. I've been growing this organization to $180 million. I've been creating new service models, new models of funding and care with managed care, home health care model that's going to be one of the first in the country for people with disabilities. So, another example for me is I just at Providence, I got a taste of what the strategic plan is going to be for ANCOR. And there was something in there that kind of hit me a little bit differently, which was just focusing on people with IDD. Personally, my opinion, that's not the way the field is going. That's not the way the field should go. We need to focus on that integrated whole person care model, like I said, that people reside in all those different areas. So we need to serve them in those areas and we'll access funding in all those different areas. So that's what I would bring to ANCOR, and I'm very proud and excited to be considered as a candidate. Thank you.
All right. Thank you, Patrick. Just as a reminder, if you have questions, please either raise your hand or put those in the chat, and we'll keep track of that and make sure to get those questions asked. Our next candidate is Richard Edwards from North Carolina. He's the Vice President of Government Relations with Community-Based Care. Richard.
Hey, thank you, Chad, and thank you, Heidi, and good afternoon, everybody. My name is Richard Edwards, and I am, as mentioned, the Vice President of Government Relations for Community-Based Care. We're a multi-state provider in 6 states, providing services to individuals with intellectual and/or developmental disabilities, to veterans, and to seniors through home and community-based services. I've been in the field now for over 25 years, working in a diverse array of services and service options, from behavioral health and child, adolescent residential services and early childhood services to persons living with chronic illness and persons with intellectual and/or developmental disabilities. My current role is with government relations, but I've also done association work, I've done board work. So a lot of these diverse experiences have kind of brought me to a clarity of my personal mission, which is really, our system exists to help people who are dealing with extraordinary challenges do very ordinary things that most people, including me, including most of the people that work in this field, take for granted. Living in the community, earning an income, voting, accessing healthcare, seeing your friends and family members when you want to. These aren't things that were on my bucket list when I started out in the field. Or when I was growing up even. But for the people that we support, our society and the systems that are built to support them present obstacles to achieving these everyday kinds of outcomes. And I think it's important to remember that the legislation that built our field, although we are in the healthcare sphere, the legislation that really built our field is actually civil rights legislation. The Rehab Act of '73 and Section 504 of the Rehab Act, Americans with Disabilities Act, the Olmsted decision. All of this is about quality of life. And so, you know, my personal mission as an advocate, as a care provider, is how do we marry both the healthcare side, the larger healthcare sphere that we're a part of, with the essential quality of life measures and mission, you know, that we all have to support people with disabilities. I believe that ANCOR is a key part of that, because providers are doing the work every day to support people to meet these everyday kinds of outcomes, and to have a dynamic, healthy, resourced provider community, I think, is essential to meeting today's challenges and tomorrow's challenges. And my work with ANCOR so far has been really rewarding in terms of helping to support that goal. To be specific, so I've been a part of the Board of Representatives now for this, nearing the end of my second term. I've also volunteered with ANCOR on a number of initiatives around the Moving Mountains Award, and currently participating in the mentorship and also on the Government Relations Committee befitting my role. And I just have thoroughly enjoyed it. I think that ANCOR's mission and its people and this community are incredibly resourceful and talented and clear-eyed about the mission that we all share. So it would be a real privilege to be able to participate in the board, and it's an honor to be considered.
Thank you so much, Richard. Our next candidate is Nadine Daly. She is the Chief Diversity Officer for the Center for Family Service, the Center for Family Support in New York. Welcome, Nadine.
Thank you, Heidi, and good afternoon, everyone. I'm very excited and honored to be considered as part of these amazing candidates. I have to say, Heidi, when I saw the list, I was like, uh-oh, but also honored to be amongst the members listed here. I would say, just in listening to the others, many of the items or the information points we share, many of the ideas and the ideologies and the methodologies we share. We're all part of different interagency organizations that our mission is to improve the quality of service within our field. And so I would reiterate and support all of the messages that my prior candidates also expressed. Personally, I have been with the field of disability services for over 15 years. I started my career in the child protective services field, and when I needed a change in mission, my idea was to enter a space where people had little or no voice. I found it here in the field of disability supports. I worked as a residential manager as my first introduction to the field. And if anyone has been in the field of DSP or residential work, that's where you learn how we're doing, what we're doing well, and what we're not doing well. From there, I learned to hone our advocacy voice. We worked together with the individuals supported at our agency, the Center for Family Support, and we started 3 different advocacy groups. These groups are led by the individuals supported, and they're supported by various different kinds of programs, and their voice are an integral part in leading our agency. I'm proud to say that the Center for Family Support has been CQL accredited for 4 different instances, and that I've been an integral part of that, leading the charge for quality, leading the charge for continual evaluation for the services we provide in this field, and for the continued challenge to push our field to be creative, to be continually innovative. My focus now, and I've evolved my roles at the Center for Family Support. I started off, as I said, as a residential manager, moved to the Quality Assurance Department, where I conducted training and evaluation and audits for all our programs across the 2 states, New York and New Jersey. In that time, I still continue to support the advocacy groups, because that is the backbone of everything that we do. I've grown in my outreach with advocacy. The advocates at the Center for Family Support have grown in their voice, in their leadership in the advocacy field. We partner with New York Alliance, which has been my information base in how to meet with senators, how to be engaging with all of our staff so that we can be politically astute and all of us be involved in moving the mission of supporting our staff, retaining good staff, supporting the individuals to have the lives that they want. What I would bring to the board, I think that I approach what I do from the perspective of being a parent of a child with a disability that has full dependency on all the DSPs that come into her life, and have had great experiences from that. And so I continue to be on the end of pushing the quality, pushing that we continue to have people that are supported and can live on the salaries that we provide for them, and pushing the improvement of our services so that the people we support are thought of as anyone, a human who needs a support, and they're on the human chain of support. So I feel that I bring that unique perspective to the board. Currently, I am involved in the Diversity, Equity, and Inclusion Committee of Practitioners for the ANCOR board. And we are a small group of, I believe, excellent thought professionals that include Sasha Sensor, and we're trying to look at the accessibility of our services. How do we contribute to the issues that we always articulate? How can we, as a field, look at ourselves, do better, and get ahead of people, especially people in the for-profit sector that are coming in and trying to take over our space? So I'm very much on the eye of forward looking of service, sustainability of services, what that should look like, and innovative thought practices that move that forward. So I thank you again, all the members that are on. Thank you, Heidi, for welcoming me and for listening to me today. Thank you.
Thank you very much. Our next candidate, and for all of the candidates, if you haven't noticed, there is at least one question that's come in the chat, so please keep an eye on that. We'll come to those questions after we have a chance for each of you to do your introductions here. Our next candidate is Leslie Corey from Step by Step, and Leslie is the Chief Operating Officer, and Step by Step is out of Pennsylvania. So Leslie, please take it away.
Thank you, Chad. Thank you, Heidi. And thank you everyone who's on the call. And also I'm going to say the same thing that Nadine said. It's a real honor to be in this group. When I looked at the candidates, I thought, oh, wow, you know, what a great group of candidates. So I'm really honored to be able to have this opportunity to be able to potentially be a part of ANCOR's board. I have been in the field for over 30 years, and I started off actually as a live-in counselor for 5 alternative living units, or group homes as they're called now. And I really, you know, got the perspective of, you know, what it is to live and be a part of working with individuals who have different disabilities. And it really centered me in as far as my work and where I went in the next 30 years. I have a very diverse background. I have a master's in health administration and also in instructional science. I have a doctorate degree in educational leadership. I have spent a lot of my time obviously working in the residential field, but also I've done it work in the educational field as well. I do feel that my experience and my education has really helped kind of put me into the path that I'm currently in as a COO. I've had the opportunity to work most of my career in the state of Pennsylvania, but for a few years I was able to broaden my perspective, and I worked nationally, and I worked in a variety of different states, which really gave me a really good perspective of how other states work within our field and our systems. We work with children from birth all the way to obviously the whole continuum, to aging, to death. We have diverse services through intellectual disabilities and autism, dual diagnosed, but also we work with children, behavioral health, and then the mental health field, and forensic and justice involved as well. I do feel that, you know, what I would be able to bring to the board would be a perspective of being creative and looking at innovation. I do have a very creative and innovative thought process. A lot of things that, I do is I sit down and I listen to our staff, I listen to our individuals that we provide services, the families, and also, the advocates and other providers, and really try to find innovative ways to work in a system that, unfortunately, the cost doesn't cover the needs that are out there. Our state is going through a significant transformation with the performance-based contracting. I believe that this is going to really change our systems and our services that we currently do, hopefully for the better, and also hopefully for our staff for the better and our individuals. I'm excited about being a part of ANCOR. I'm part of ANCOR through PAR, as well as through RCPA within Pennsylvania. I'm a very active member and I participate on several of their committees. And I do believe that, again, my role would really be able to take a look at not only what we do within our state, but also within other states, but then also at the federal level. I do feel that there's a lot of things that, we're doing, that we're changing statewide that could be replicated from a federal side as well. So I look forward to that opportunity. And I thank everybody for this opportunity as well. Thank you.
Thank you so much, Leslie. I'm excited to introduce the next candidate, Robert Budd. Robert is the CEO and president of Free Inc., which is located in New York. Welcome, Robert.
Good day, everyone. It's great to see so many folks on the call, and I echo the sentiments of those who have spoken before that it's a wonderful sign for ANCOR and ANCOR's reputation that there's so many people who are so interested in joining the board. So I think that's a good indicator of what I feel very passionate about. That is that ANCOR is the national voice for our field. As a multi-service provider that is comprised of a partnership model that has organizations such as Adelante here, Suffolk County on Long Island, that only has a few staff members, to Free that has a couple of thousand staff members. I think it models very nicely to the composition of our membership in ANCOR. We have such a diverse group of provider organizations doing amazing, magical, some days work. And I think that really is such a beautiful opportunity that has come about in many cases because of the support and vision that ANCOR has provided throughout the nation. And I think it's a unique moment in time for us to be able to support the very diverse efforts of our states in reinventing. I think also the perspective that I bring because of my many decades now of participation in different committees on ANCOR, and a very happy and proud to be part of our foundation board, and the idea that we are looking for not just the challenges, but the innovative solutions, and to find that constructive center of all these various perspectives throughout our nation. And most recently, over the last few years, through our global council work, to look for solutions by being inspired by what's happening internationally. Having been part of that, having been part of the creation of our DIA efforts and our reinitiation of our global council, or some of the points of passion that I still have when it comes to being more involved in ANCOR, I look forward to being able to support those particular areas. But in general, I believe that we have such talent, and the match of my personal passion for synergy matches the core values and strategic pillars that ANCOR has put forth for at least the last 15 years that I've been closer to the leadership aspects of ANCOR. I think also just in a time where there are so many passionate different views, having someone that has experience as a coalition builder and the founder of associations, and then seeing them through that maturation process, I do think is an asset and a perspective that can be helpful to us in a core time within our field. And so that is, in a nutshell, my interest, my passion, And I do want to mention that I became involved with ANCOR when I was the president of our statewide association in New York. And it was because of the core values aligning so beautifully, and was thrilled recently when the New York Alliance became the first New York State 100% member. And it took us a couple of years. We have a lot of varying opinions in New York. But I do think that has been such a resounding success. And I know that one of the key goals for ANCOR is to continue to enlarge our footprint so that we can continue to have an even greater impact with our government relations advocacy, as well as our advocacy work within CMS for policies and re-envisioning of the core elements that we all know make quality services.
Thank you, Robert. Our final candidate before we get into questions from Pennsylvania is Stephen Bruce, and Stephen is the Vice President of Operations with Devereaux Advanced Behavioral Health. Stephen?
Hello, good afternoon. Again, my name is Stephen Bruce. I'm with Devereaux Advanced Behavioral Health. And, again, I'm honored to be considered for the board with these great colleagues. And, one of my great desires to be part of the ANCOR board is for this reason. We have such a diverse and excellent group of members, not just board members, but across the whole organization. And when I was kind of preparing a few notes, thinking what I wanted to share with people is I realized, I've spent 38 years in this field, working with people with disabilities, children, adults, and done a lot of different positions like many of you have, from starting with a DSP, which it wasn't called that then. We were just residential counselors, to frontline managers, to clinical experience as a BCBA, run residential programs, day programs, and consultation services. So I definitely have a lot of different experiences that I think I would bring to the board, which would be helpful, from operations to strategic planning. As an executive director of a private nonprofit school at one point. So I think that those are things that I would bring to the board that would be helpful. And, through my career, and as many of you have experienced, different things from helping transition shelter workshops to community-based employment. That was a big experience we had in New Jersey, still going on in Pennsylvania. And, way back, moving people from campus settings, right, to group homes, and working through the not in my backyard concept. So we've all come a long way. And I think that those experiences certainly lend to what I would add to the board. But the most meaningful, thing for me in my career really has been having the impact on individuals and families. And that's really my passion. Is I think about the work that we do in all these different roles, and certainly now at a higher level. How does that really impact those that we are here to serve, and their families and their siblings? And that's what's most meaningful to me. So in my current role, I bring experience with as vice president of IDD services for Devereaux Advanced Behavioral Health. And, we're in 11 different states, and six of those we serve individuals with IDD, Pennsylvania, New Jersey, New York, California, Florida, Massachusetts, and most recently Georgia. So, those experiences, and I see many faces on the screen here that I've worked closely with, in PA in PAR, have really helped build my knowledge and my experiences. And I hope to, bring that to the board. Now, I've recently been more involved in ANCOR, like some of you, just pre-pandemic. I was able to join through the PAR connection, the Alternative Payments Committee, which was a great way to get involved. And we did a few visits to other states, and that was very helpful. So one of my focuses is on alternative type payment models for those that we serve, and the challenges of Medicaid, as we know, and how to make that work with the move towards managed care. And I know it was mentioned earlier, Pennsylvania is going through a really, really big challenge now with performance-based contracting. And that's really a start, most likely, of where this is going. So that is definitely what I feel like I could bring to the board in my experiences in different states and working in different trade associations in Pennsylvania and New Jersey. So the other focus that I have and throughout my career is serving those with more acute challenges, through using technology, but also through physical plant modifications and also staff training, which I think is key to have qualified staff, especially for those that have more challenges. And that's something that I've been focused on throughout my career, and I would want to be able to bring to the board. So just kind of in conclusion, it would be a great privilege and honor to be elected to the board and to serve.
Looks like he may have froze. Is that seeing on the
Thank
screen? Oh, there you. Okay, thanks, Steve.
Yep.
You were
Okay.
frozen for a second.
Was I frozen?
Just fine. I think you were just saying, summarizing.
Okay, yeah, I got cut off. I'm sorry. I'm working very remotely today. And yeah, so again, it would be a privilege to be considered for a board seat, and I'd be very honored to serve. Thank you.
Thank you. All right, we have a few questions that have come in, and I'm going to try my best. We have 27 minutes left, and I want to try to summarize these first set of questions. And I see Patrick has taken an opportunity to respond in the chat, but these are for all of the candidates, and they're related to DEI initiatives. And I think there are three themes here. Representation on DEI boards. And so should boards overseeing DEI initiatives include members from marginalized groups? How do you balance this with other necessary qualifications? The other theme has to do on standards and DEI initiatives. How would you address concerns about that come from outside about DEI initiatives? How would you ensure that these efforts maintain or improve quality and performance, and how do you measure that? And then the measurement piece of it. As a board member, how would you evaluate the effectiveness of DEI initiatives across the association, and what metrics would you focus on? And I hope that was a good summary of the questions. Please let me know if not. But at this point, I'll turn it over to the candidates to respond. And whoever would like to take a stab at it first, please, by all means, go for that.
It's Nadine. Chad? Okay.
Yes, go ahead, Nadine. Yeah.
I guess it makes sense. My role is the Chief Diversity Officer at my organization. And that role, I actually wrote a business plan to my CEO describing the need for it. And I would generally say to all that in researching DEI efforts, the focus is always on educating people in front of you on the benefits. And statistically, for people who are embedded in quantitative measures, there is statistical measures that support that, having inclusion practices, having areas where your staff, just as we as leaders in organizations feel included in ANCOR, and it makes a difference in how active we are, it applies to all of our agencies and all of our staff personnel. So I would say that there is qualitative and quantitative data to support the need for DI initiatives, DI education for all level of staff, especially when we're working with people that we're supporting to be included in our society at large. So that would be my take on it, Chad.
Thank you, Nadine. And I see Richard has hand up. Richard.
Yeah. Yes. Thank you, Chad. So I will say I think this is very important, and the things that I would be looking for would be, one, are you talking about it? Or is this a question? Like, are we asking these kinds of questions? Are we creating work environments, for instance, that are welcoming and inclusive for persons of all backgrounds, right? And that's sort of, you know, one part. Are we taking that information and are we putting it to use? And then is that reflected in the leadership of our organizations? Now, obviously, I'm, you know, here on, you know, on the meeting as a white male, and you know, when I look around our field, I see a lot of white males, and you know, I recognize that. And I think, you know, as ANCOR, as an organization, but also as organizations, you know, when we look at our workforces, you know, we have, I mean, I'll speak for myself, but I know I'm not speaking for myself when I say that, you know, a large percentage, the largest group of our workforce are women of color. And so, you know, how is it that we are creating, you know, pathways to leadership and mentorship opportunities and DEI initiatives that support our leadership to be representative of the people that we employ? And I think that that's important, and that's a, you know, a strategy that needs to be taken into account. I did want to just address the mediocrity question real quick and just say I think that that is just patently ridiculous. And, you know, part of the reason I say that is, you know, I think the hardest job that we have is the direct support professional, and 40% of our direct support professionals are persons of color. So you're not going to tell me that, you know, that we're creating mediocrity when, you know, in our field. That's, like I said, just I didn't dismiss. I know we hear that, but I dismiss that out of hand because our, you know, that just doesn't line up with our reality. So I'll pause there.
Thank you, Richard.
And if I could add to that too, you know, again, people are really literally the core of diversity, equity, and inclusion. And obviously in our services, we rely on people to provide the care for those that we provide services to. I know it's step by step. We've been committed to fostering, culturing, and preserving a culture of not just diversity, equity, and inclusion, but also belonging. So we have a what we call a belonging, inclusion, equity, and diversity committee, which is part of our trauma-informed initiative. We have taken it upon ourselves to really look at our organization. I've been with the company for 3 years now, and in that time frame, we've been really transforming to be more of a trauma-informed, resilient-oriented, and equity-focused employee. We focus on educating, we focus on looking at our policies and procedures and making sure that they are also following, you know, equality, inclusion, and diversity. We also do surveys, and we do surveys not just of our staff, our direct care staff and our managers, but of our C-suite, of our boards. We look at doing surveys for our vendors and suppliers to make sure that we're including all of those that we work with to ensure that we're not just saying we're DEI, we are actually literally placing this into our actions as well.
Thank you, Leslie. I saw Precious had hand up too.
Thank you so much, Chad, for that. And thank you, Dr. Hassan, for your questions. They are deep. And definitely something that requires some more conversation beyond just this meeting. But when we talk about measures, we want to make sure that as we're looking at ANCOR's inclusive mission, that we are doing things like, and we already have a committee looking at that. So it's not to say that, but in my response, we should look at what's the diversity of our workforce and our leadership with our member organizations. How do we measure that? Are we measuring that? How engaged are those people who would meet this category and engage with ANCOR Foundation? That helps to inform us to where we need to go next. What are our training associated with DEI, and what does that mean for provider associations? And so there are so many ways that we need to measure, but we always need to come back and look and find out where we need to go. Now, on the question, I too think, you know, the critic thing is absolutely ridiculous. And but for me, diversity, equity, inclusion, and accessibility are not things that are compromising standards. What we're doing is leveling up. We're making sure that everybody has a fair shot. We're doing our best to lay a foundation that everybody can play on the same playground. It is not an issue of lowering our standards or making it so easy for someone else. We're just giving opportunities where there is a gap. when we look at DEI, what we're essentially doing is standing in the gap. We are not bringing down, so the critics can say what they want to say, but we at Anchor know that we will put forth the efforts, and you're already seeing it with the committees that Nadine is talking about, seeing what Sasha is doing with her leadership in diversity, equity, inclusion, and accessibility, but looking at how these standards help to make sure that we have voices being heard from all of our members and our members' members. So I just wanted to just add that piece in there. Definitely a conversation that we need to continue on, and thank you.
Great line of conversation. Are there others that wish to comment, or are there additional conversation lines that somebody would like to bring up?
Well, this is Steve. Just precious, absolutely. Just, I think looking at the data is key here. How diverse are we? Do we have equitable policies? And how does that translate to inclusion? But then going beyond that, how do we look at opportunities? And Precious said a lot of this more eloquently than I can, but that, are we providing opportunities for all to get education, to move up, to get training? And I think that's key. And as again, it's no secret, I'm a BCBA. So I do like to let's look at the data and see, are we really making an impact? Because there's we all have committees and we all have different things going on, but how does that translate to actually, changing things? So that's what I wanted to add, is that I think we need to make sure we truly are looking at the outcomes, and are our actions having an impact?
Yeah, the only other thing that I would comment on, everyone's spoken so eloquently already. I do love the question about the metrics as well. When we began our DEI work with Anchor, there were quite a range of diverse perspectives, and it was actually through a facilitated process that the board decided to move forward and take on this commitment. And I think, and as Nadine and Precious mentioned, Sasha's work with Anchor on this area, I think, has been just so powerful and so exemplary. And I think the power of good example for an association is that influence power that we have. I think it gets more complicated, and we certainly wrestled with this from the beginning. I see Michael Seawriter on. It was part of the advisory group to have the New York Alliance take on a DEI initiative for New York State. And the role of an association, I think, becomes a bit more challenging in some ways, because you're trying to meet people where they are, make it a safe and respectful environment for people to be able to move forward and to make the commitment that ideally you want to have seen. And then certainly my own experience within our organization on the behavioral health side, we went with the class standards. And that certainly was because I believe there's power in using national statistics and allowing and aligning state and individual organizations with something that sets a standard for our field. And when we look at our ability to advocate as a field, sometimes we are a little behind some of the other national organizations because we don't have universal definitions of quality in many areas and universally accepted definitions of how to measure those. So I think this is yet another great thing that Anchor has already commissioned. Love the progress that's been made and see great opportunities for us to continue to evolve in these areas.
Great, Robert. Are there any other questions that anybody would like to ask the candidates?
So I don't have a question, and I want to thank definitely the candidates for even having the opportunity to address these questions spot on, right? The intellect and the response from the candidates made me feel really, really good. And everyone on this call understands, and we don't say names because it's not the field for it, that comment made about mediocrity was just recently said about DEI, right? So this is something on the forefront, and this is These are politicians making laws and legislation and running for office. That's scary. That's number one. Number two is thank you guys for, and you saw my comment with a smiley face on there. Thank you guys for not just talking about it. We hear talk all the time, but providing some great examples of what you have done, what you're thinking about doing, and representation, because that's truly what ANCOR is looking for. Extremely happy at the responses. And you guys are very fortunate we don't have that a different format where we can just ask questions of each other and you challenge each other at the last moment. But this was well said and well done. Thank you to the ANCOR team for doing this.
Can I say one more thing?
Please do.
So
Patty.
that last question kind of hit me too, because we're in healthcare, so we're looking at FQHCs, which require 55% of our board to be represented by people that we serve. And what we ran up against with that was in our existing board, some hidden bias that we did, well-intentioned people. And the same thing happened to us when we hired some consultants to help us come in and figure out what we're doing with DEI. We were well-intentioned, but we didn't even realize what some of the issues and challenges were that we had until that happened. So I think that's something that ANCOR, I don't know if they do that or not, but helping organizations to have consultants to come in and help them understand about hidden bias and things like that, to just get a better perspective of where you're at and where your starting point is, for your efforts. Thank you.
Thank you. And as Barbara mentioned in the chat, great, affirming and powerful conversation. And thanks to everyone for that. Are there other questions for our candidates? We have 12 minutes left, so there's plenty of time if we want to do any quick questions here for folks.
I will pose a question. And it's for anyone, but I think, listening to Precious talk about the technology and innovations, and then as it intersects with being inclusive, do any of the candidates have examples of how they have used maybe forward-thinking models, technology? I think it was Patrick that just talked about, just discovering unconscious biases as they looked at their board and how they were going to meet the desire to have 55% of their board representative of the people they serve, which is phenomenal. How would any of you make those things intersect as we go into this changing world and way of delivering the services that we have, the desire for there to be more technology, enabling technology for people that get them more involved and included in activities, and that could be their lives, the organizations that support them. Do any of you have any thoughts around how to push that forward and how you could apply that that skill set to our board? Thank you.
I'll take a shot at it. So, Ohio, a couple of years ago, the governor came out and said that we're going to be a tech first state.
Let's see.
And that's great to say, but the funding didn't follow that initiative. And we ended up having to battle Medicaid and the other funding sources to say this is a right of people with disabilities to have this technology. They need it. It could be written into their service plans, all the rest of that. But I think that's an ongoing battle. Our field is the funding sources are notoriously cheap, and they use money as an excuse, but it's poor quality of service, because of that. So I think that's an effort that we can take up not only in the States, but at the national level even more to push that.
This is Nadine. I just wanted to add quickly. We've had some different models that we've tried utilizing technology to support individuals for more independence, creating alternative housing models that supports people who can't reside in like a group setting. We've had some success with those, create an independent living situation. We're also utilizing artificial intelligence and to screen candidates, to look at platforms like Inclusively that delivers a diverse group of candidates for you at different levels so that you can make sure that you're sourcing as broadly as you can. So looking at embedding technology into your inclusive and access processes, I think is part of our future direction. How we can broaden, how can people with disabilities have access broadly to healthcare supports as you do, including telehealth, how we can utilize artificial intelligence to streamline some of our operation processes to make it easier for staff to access work hours and all the other kinds of information that we need to translate to them. So we have begun to embed it and begun to be part of the conversation about how it should be everywhere in what we do, and how we should start to look at responsible policies and ethical practices globally as we as a field are moving into that space greater.
The next hand that I see is Precious.
Thank you so much. This is definitely a topic that's near and dear to my heart. So when we are talking about enabling technology and integrating technology, the utilization and being innovative in service delivery is another form of advocacy. It's another form of meeting a person where they are and helping them to get to their dreams, wishes, and outcomes. So when we look at the people we support, we are doing this work, rehabilitative services, so that they become contributing members of society. And when we have these members in our society as a whole is diversified, included, and better. So when I look at someone who has received supportive living periodic, for example, drop-in support. She doesn't want you in her face 24/7. She wants the service, she needs help. She wants to go to the doctor and have the doctor talk directly to her, not to the staff person that's sitting next to her. Well, the regs don't allow for that kind of thing all the time. Somebody's receiving a service, a staff person has to be there by their side. Our role is to be able to think innovatively that how can I be by her side and still get her and meet the regulations so that I can create an example that then I can show government that this is a useful service. And so when I'm FaceTiming with her and I have her in my ear and she's looking at the phone talking to me and I'm helping her pick out the right bus, pick out the right road to walk in, to advocate for her doctor. I'm technically still by her side, except that I'm virtually by her side. So I met the regulations, she met her outcomes, and I had an example to show the government. So when we are talking about advocacy and how it intertwines, some of this is helping members to build up the right amount of examples so that when we go to legislative or when we're focused on our inclusive mission, that we have something tangible for people to learn from. When they learn that, then they implement it, and then they start providing better services at the provider level, and the people supported start receiving better services, and our community gets the whole of its being, and we are better in the outcome.
Thank you so much. Any additional comments?
Just one. Again, the technology for those that are more independent, very appropriate, need to head there. I think that our advocacy efforts also have to focus on those that are very challenged, right? And how we can support them as independently as possible in 24/7 type arrangements with a plan for getting them towards the community, getting them more independent, to step down a continuum of care. So I think that I'm not disagreeing with anything anyone's saying. I think that a focus for those, because if you think about where a majority of the dollars are spent, they're for those with more challenges that need 24/7. And how can we reduce staffing needs and help them move along in the continuum? And that's something that's a big focus for myself.
Thank you. And I wanted to call attention to Leslie's comment in the chat as well, her response. Any other comments on this topic or, oh, I see Robert out there.
Yeah, I echo, certainly not my area of expertise. I love the work that Precious is doing in this area. But we've had extremely positive outcomes fostering greater independence and autonomy. And I think that really is so key to true inclusion and integration. But the other comment that I wanted to make is that ANCOR had been a real leader in this area, I guess about 12 years ago or so, when we used to have this wonderful technology conference. And then we kind of thought that the university was taking it rolling. There was a whole disability technology rights bill that we promulgated to pass out to all of our members, et cetera. And the university went in a different direction. But I love the fact that ANCOR is back on this, because I do think it is an area that we are uniquely positioned to be a great influencer and disseminator of all these amazing examples that our members have to share. So I'm really thrilled with the direction ANCOR currently is in, and think it's another opportunity for us to step up to the plate to fill a void and to provide leadership to ensure that this happens in a funded, core value-driven manner.
Thank you. Tony, I saw that your hand was up. Did you have a question that you wanted to add?
No, I just a comment, Heidi, for all the candidates today that having been on the board, for the past couple of years with, Barry and Linda and Josh and a few other folks that I see on the call today, Diane, the ANCOR board really has taken DEI, and we call it DEIA with the accessibility piece, very, very seriously. There is no mediocrity in our approach on this. It's all hands on deck. And it's a really very, very solid approach. And I just want to assure the candidates that when you walk into the board meeting for the first day, whoever walks in, you will have that, you will know that DEIA is present. That's what you will know. So that was it.
Thank you very much, Tony. I'm seeing some notes in the chat about this is great information, and it really has been wonderful. It's been a wonderful opportunity. Perspectives. I do have a couple of pieces of information I'd like to share as for the process. Electronic voting will open on Monday, August 5th. On Friday, August 23rd. Only designated voting representatives from election will need a quorum of at least.
Heidi, your mic's going in and out.
Whoops,
there.
sorry, Chad.
Yeah, try it again, Heidi.
I'll try one more time. I just wanted to make sure people knew that the election is going to run from August 5th, starting on Monday, until August 23rd on Friday. Only designated representatives from each organization can vote, and we'll need a 10% quorum of membership for the election to take place. I hope if there's any further information needed, please reach out. If you need information about who the voting member is for your organization, please reach out. Candidates for throwing your hat in the ring, and for everybody that joined to hear about our candidates. Thank you so much.
Thank you.
Impressive group of candidates. Really, very impressive.
Thank you, everyone.
Thank you so much. Bye.
Thank you all for joining us today. Again, as Heidi said, appreciate it.
Bye, all.
Best of luck.
Chad and Heidi, thank you so much for leading it. Thanks, guys.
Robin, if you have a second afterward.
Great job, everyone.